Hi, it's Frank again with OxygenGuy.com, here to talk to you about how to choose an oxygen provider. Now, being that I've worked for various oxygen providers, I can tell you that they're not all the same. But when it comes to it, you really have to weigh the pros and cons, because otherwise you're going to be with them for a while and you want to make sure you're getting what you want. Let's see here. The first thing, honestly, it's not Amazon. It's not any of these online places. You're probably not going to get a whole lot of actual reviews just looking around. The best thing you can do is ask friends, family, doctors, nurses. Ask them what good things they've heard about different providers. Now, most hospitals that I know of actually have a deal when the patient's coming out. They actually have a list of providers, and they pick one, and that's who you get today. But you have a choice. So ask around. Have you dealt with this person or this company? How are they? What's their service like? Are they friendly? And yes, that's the thing. You want to make sure the word of mouth is good. Now, distance, that's another thing to consider. How far away are they from you? Do you live in this town and they're 30, 40, 50 miles or even further away? I've heard of cases with different companies where they're hours and hours away from their patients. In fact, I had one, it was the longest I think I had was 2.5 hours, but it was one patient among many, many, many. We just happened to have them as part of our company for whatever reason. Nice people, but I'd rather have been a little bit closer to them. That way I could give them the service they deserve. But they were happy, we were happy, everybody was happy. So it's really a matter of your comfort level. They weren't really what I would call an at-risk patient, but either way. Also, are they a 24-hour emergency service provider? You want to make sure if something's wrong, your machine breaks down, someone's coming out to fix it or replace it, whichever's necessary. It happens. These things will happen. Or say, God forbid, a fire happens. You want to make sure that someone's bringing you equipment if your equipment has been burnt. So with that, it's important. Do they provide it or they don't? Let's see here. Friendliness of the staff. When you call the office, you want to get somebody on the phone. Hi, I'm Joanne. How are you doing today? Or Bob or whoever. But you want somebody that's going to be nice and answer your call. You don't want to call up and get a robot and spend 10, 15, 20 minutes waiting for someone to come on the phone. At least I don't. So friendliness, it's a huge factor. And as long as the staff too. I mean, when someone's coming out like me to visit you, you want them to be personable. I mean, they don't have to sit at the table and eat dinner with you every night, but you want somebody that's looking out for you and is a decent person. It's not too much to ask, truly. You want a good person bringing you your equipment, your oxygen, doing your maintenance, and there's plenty of good people out there. Make sure you get one. Inventory. Do they carry enough inventory? When you walk into their office, do they have their warehouse? Do they have plenty of tanks to provide you the oxygen you need? Do they have plenty of machines? So if yours does break down, and it will happen, I don't care if it's really new or really special, things do break down, that they can bring you another one right away if they can't fix the problem. Also, what kind of equipment is it? Is it new or is it so old that the noise is just horrendous? That's something you want to consider right off, because you want to see it. Let me see the equipment. Turn it on. Mind you, oxygen machines are loud, but there's varying degrees. There's, I can hear it a little bit to, wow, the neighbors are complaining again. So make sure you get yourself something you can live with before you sign your contract. And also, do they provide portability in the form of a portable concentrator if you want it and you're able to use it. That's the other thing. Sometimes you have to do the testing. A lot of people could handle it and a lot of people can't, because most of your portable oxy concentrators are based on a pulse dose instead of a continuous. But even then, there's pluses and minuses when it comes to portable oxygen concentrators. Too many to list right now. We'll do something on that another time. But yeah, you want to make sure what you're getting what you paid for. And if you don't care about a portable oxygen concentrator, then you're good to go. Personally, I like the tanks because when you open them up, you have air. So I'm kind of biased. Let's see here. Now also, yeah, we covered that. Oh, with tanks in particular, there's different versions of tanks. You have your regular tanks that just use your regular old oxygen key. And then you have ones that come with a toggle key on it. Now, some people love those because you can just open it up right now and you don't need the wrench. And others, they don't want them. They like the wrench. And that's it, period. So if it matters, ask, what do you carry? And if they carry both, can I have a preference? Let's see here. Now, are there locations nationwide? If I go to visit my Aunt Fran in San Francisco, or wherever your aunt or uncle or best friend or wherever they're at, will there be a provider nearby that can help me? Now, it doesn't necessarily mean that there's other places out there that have contacts that aren't necessarily their corporate offices, but they have contacts that they can hook you up with and get you help. So you're always covered. But that's truly the difference between a corporate and an independent. A corporate has many more locations around that they can get you help while you're on vacation or visiting friends or whatever. So something else to keep in mind to make sure you're covered. You don't want to have to try to get a doc script faxed to a provider in some strange place that you're not really aware of trying to get help. Get yourself some cannula or a CPAP mask or whatever. It's nice to have wherever you go coverage. So with that, you do have a lot of thinking to do. I definitely wouldn't pick anybody just at random. Make sure you're getting somebody that's good, great, that you're happy to have, because it's a 5-year period before you can switch out. So, with that being the case, I wish you luck in your decision, and like I said, think about it and you'll be happier for it. All right, you have a great day. We'll see you soon. This is Oxygen Guy. Be good.